The birth control pill is one of the best methods to stop you from getting pregnant. It's easy to use, and when used the right way, it's 99.9% effective in preventing pregnancy. It must be prescribed by a doctor or nurse practitioner. So how does it work? Most birth control pills contain 2 female hormones. These hormones stop you from ovulating. That means your body doesn't release an egg each month. It also makes the mucus around the cervix thicken, making it more difficult for sperm to travel into the uterus. At the Sexual Health Center, we sell 28-day packages of pills. This means you take 1 pill a day for 28 days. The first 21 pills contain hormones, and the last 7 pills don't contain any medication. It's during the week that you're taking those last 7 pills that you will get your period. Your doctor or nurse will tell you what day to start taking the pill, and you take 1 pill a day until the pack runs out. Then start a new pack. You should never go a day without taking a pill. It's really important to take your pill at the same time every day. It doesn't matter what time of day you take it, just pick a time of day that works best for you. To help you remember, program your phone or watch to beep at a specific time. There are also several free smartphone apps that can help you. Pregnancy can occur if you don't take your pill at the same time each day. So, remember to take your pill within 2 hours every day. Don't forget that the pill will not protect you against pregnancy during the first month, so it's important to use a condom every time you have sex. The pill is very effective at preventing pregnancy, but even missing 1 pill can increase your chances of getting pregnant. If you forget to take your pill by a couple of hours, take your pill as soon as you remember, and then take your next pill the next day at the regular time. If you forget to take your pill for a day or more, please visit sexualityandyou.ca and look for their SOS app. This app will help you figure out how to get back on track. When in doubt, you can always call the Sexual Health Center and speak to a nurse. And please remember to use a backup form of birth control, like condoms, for the rest of the month, as you may not be protected against pregnancy. Some common side effects of the pill are breast tenderness, mild headaches, mood changes, breakthrough bleeding or spotting between periods, and mild nausea or feeling sick to your stomach. These side effects only require a doctor or nurse practitioner's attention if they become bothersome. If you have breakthrough bleeding or spotting between periods, don't stop taking your pills. This is quite common and will most likely go away in time. If your spotting continues after 3 months, please talk to your nurse. Serious side effects from the pill rarely happen, but it's important to know the signs and symptoms. The most common serious side effect is a blood clot. If you notice any of the following symptoms, please go to the nearest hospital as soon as possible. Severe abdominal or stomach pain, chest pain and shortness of breath, severe headache, blurred vision or loss of vision, this might be in one eye only, and severe leg pain. Smoking can increase your risk of a blood clot, especially if you're over 35. If you're thinking about starting birth control, this is the perfect time to think about stopping smoking. Talk to your nurse about some ways to help you quit smoking. The pill also has some side effects that most girls really like. These can be lighter periods, less cramps, less acne, regular periods, and even some protection from certain cancers like ovarian and uterine cancer. There are also some other types of birth control that you may like better. For example, there's the patch, which is like a Band-Aid you place on your skin, and it's more than 99% effective in preventing a pregnancy. The patch releases hormones that stop you from ovulating and thickens your cervical mucus just like the pill. You only have to change the patch once a week, and it's a great option if you're finding it hard to remember to take the pill on time. There's also the NuvaRing, which is a flexible plastic ring that contains hormones. You insert the ring into your vagina, and it stays there for 21 days, and then you remove it for 7 days. It's 99% effective in preventing pregnancy, and you only need to remember your birth control once a month. Another form of long-term birth control is the intrauterine device, or intrauterine system. The IUS, or IUD, is a plastic or metal T-shaped device that's placed in the uterus by a doctor or a specially trained nurse practitioner at an office visit. It can be left in place for up to 5 years and is 99.9% effective in preventing pregnancy. If you forget a pill and have sex without a condom, don't forget about the morning after pill, or Plan B. Plan B is 2 hormone pills that you can take within 5 days of unprotected sex that can reduce your chances of becoming pregnant. The sooner you take it, the better it works, so try not to wait. You can get Plan B from the Sexual Health Center or from any drugstore. You just have to ask at the counter. Remember that the pill doesn't protect against sexually transmitted infections. STIs such as chlamydia, gonorrhea, HPV, and herpes not only can cause pain and other unpleasant symptoms, but can cause sterility and even cancer. That's why it's important to remember to use condoms every time you have sex. Condoms are the only form of birth control that can prevent both pregnancy and sexually transmitted infections. Condoms are always available free from the sexual health centers, so feel free to help yourself. Please talk to your nurse if you have any questions about the pill or other forms of birth control. We are here to help.